twice as much at risk. So there is a genetic component that you have to pay attention to. But in addition to that, there are diet and lifestyle issues. Men who smoke cigarettes are much more likely to be diagnosed with prostate cancer. Men who have a diet that's high in red meat and animal fats, milk and dairy products, have a higher incidence of prostate cancer. Men with higher testosterone levels, men with BPH or enlarged prostates tend to have a higher incidence. Obesity is a major factor. Maintaining proper body weight is a very important issue when it comes to preventing cancers of all types, but in particular prostate cancer. And sedentary men are also more prone to prostate cancer. So all the things that are good for your general health, maintaining proper body weight, eating a healthy diet, fruits, vegetables, reducing your intake of red meats and animal fats, all of those things are important components in preventing prostate cancer. And of course, choosing different parents would also help quite a bit.
If only. All right. Next question. How do you detect prostate cancer?
Good question. And the answer is there are two basic tests that help determine whether someone has prostate cancer or not. In the old days, there was just one, and the doctors 25 years ago would wait for symptoms to start to show, pain in the pelvic region, blood in the urine, and so on and so forth. And they would do something called a digital rectal exam, where they put on a rubber glove and lubricate the index finger with KY jelly, and then insert it in the rectum and feel the prostate, which is right next to the lower rectum, and they would feel for lumps and ridges and abnormalities. Generally speaking, when you reach the point where you've got lumps in the prostate that represent prostate cancer, it's a more advanced prostate cancer. So that's a test that's done, but perhaps the more important test nowadays for early detection is a test called PSA test, prostate-specific antigen. And PSA is a protein that it comes from only two places in the world. It comes from a functioning prostate, and it comes from prostate cancer. So they'll monitor the level of PSA in your blood by drawing a vial of blood once a year. Generally, a man over 50 years old should be doing this, and over 40 if you're in a high-risk group. And they look for PSA, and the normal range for PSA is 0 to 4. And the units are nanograms per milliliter. A nanogram is a millionth of a gram, and a milliliter is a thousandth of a liter. So we're talking extremely tiny quantities. So they look for the normal range, 0 to 4. But nowadays they're looking for something beyond that. They're looking for what they call PSA velocity. So if your PSA, even within the normal range, is rising rapidly, and by that I mean 0.75 of a point per year, then that's a red flag, and that means that you want to pay more attention, possibly have a biopsy. But it's the combination of those two tests, the digital rectal exam, DRE, and the PSA test, that help doctors determine whether there is the likelihood of prostate cancer. And if either of those tests give them a positive signal, that's when they do a biopsy, and they remove a number of core samples and then examine them under a microscope to determine if you have prostate cancer.
Now, you mentioned men over 50 should be getting a test once a year, and men over 40 if they're in a high-risk group. Mm-hmm. In your experience with all the different patients that you've met, have you met any younger men in their 20s and 30s who have had prostate cancer?
Yes. Matter of fact, men are being diagnosed at earlier and earlier ages nowadays, and that's good news, because with any disease, particularly with cancer, and especially with prostate cancer, if you catch it early, you have multiple alternatives, and there's no reason in the world why you can't destroy the disease and maintain quality of life. But catching it early is key. And in my group, I now have close to 5,000 members in my group from all 50 U.S. states and 28 countries. We have probably 300 or 400 men in their 40s in our group, and we have 3 men who are in their 30s, including one who is 33 years old. So It is a disease that is affecting younger men, and the good news is people are paying more attention to it.
Now, I'd like to take the interview into a slightly different direction.
Mm-hmm.
I want you to share with me, if you can, the procedure of research you took to learn about prostate cancer. Specifically, according to your book, you went to a number of doctors and got a lot of conflicting opinions, and then you went to cancer patients, and you talked to them. So, if you could just give me a little bit of a synopsis here from the time you were told that you had prostate cancer, how you reacted to it, and then your procedure in getting the research up to interviewing cancer patients.
Mm-hmm. Well, the date was August 10th, 2000, and there are some dates that you never forget, and that certainly is one that I will always remember. And I, at the time, thought it was the lowest point in my life. And, of course, you start to think about your mortality. I was 57 years old at the time, and my younger daughter was engaged to be married, and I'm having thoughts of, will I be able to walk her down the aisle? Will I ever see my grandchildren? And all these crazy things go through your mind. But after getting over the shock of the diagnosis, I began my research. I refer to myself, I believe I mentioned this in the book, I refer to myself as a recovering engineer, and as such, I'm comfortable wallowing in technical detail. So I went after this the way I think many people do. They first meet with their doctor, and then they start meeting with physicians that represent other treatment modalities, radiation, surgery, cryotherapy, and on and on and on. And then I started reading books. I purchased every book I could find on the subject, and there are many. Started reading magazine articles, newspaper articles, researched the internet. And what I discovered, to my dismay, was the more research I did, the more confused I became. And that included the physicians that I talked with, because what I discovered when I met with a urologist who was fundamentally a surgeon was that I was the perfect candidate for surgery. And then I met with a radiation oncologist, and I was told I was the poster boy for external beam radiation. And the brachytherapist who did seed implantation told me that seeds were designed for me, and same thing with the cryotherapist that does liquid nitrogen treatment. So the more doctors I spoke with, the more confused I became. How could I be the perfect candidate for all those different treatments? And they are so different. And one of the things that I did in my career was to, one of my responsibilities as part of my responsibility for worldwide operations for a major chemical company was purchasing and materials management. And I used to instruct my people to make sure that before we buy a product or service, that we talk with customers who have been purchasing this product or service. And I decided to apply the same process to my research. And I started interviewing former patients. Finding former patients was very difficult at first. It wasn't hard to find former surgery patients because they were all around me. Although when I asked physicians to speak with their patients, they were resistant to allow me to do that. Now, this was before patient confidentiality laws, HIPAA regulations were in place. Many of the doctors would say, why do you need to talk with my patients? I can answer all your questions. And my response was, well, no, you can't. You can't tell me how you feel today. You can't tell me about your side effects today, sexual function, urinary incontinence, and so on. And you can't tell me if you'd make the same decision all over again. So I just set out to find former patients. And once I found one, I could find two more, because a surgery